Welcome to COHERINET TV. I'm your host, Mirembe Mariam, and this is Building Bridges, a show where we bring different community members that are doing high-impact strategies to improve access to sexual reproductive health and rights services to women and girls at the grassroots in Uganda. Today in the studios, we are going to be having more insights from a community health worker on how he's improving access to sexual reproductive health and rights services for women and girls in Kalangala District. You're most welcome, sir.
Yeah, thank you. My name is Sevalam Robert, a health care provider within the communities of Kalangala Health Center, actually Kalangala District, but mainly referring to Kalangala Health Center 4.
Could you briefly tell us about the work you're doing in the community?
Mainly I'm a community educator, sensitizing the communities on how to prevent mainly the unsafe abortions because they are so rampant in our communities. Yeah.
You've brought in an important part of unsafe abortions, like could you share with us some scenarios of how these unsafe abortions are happening in the community?
We have a number of people because we all know that unsafe abortion is being carried out right from our younger girls, the mothers, and everyone who is eligible to conceive. But the community, for them, their understanding is mainly on that they can carry the unsafe abortion deep in their villages by the use of the traditional birth attendants, the peers themselves, using local herbs. And you find that people are very much affected after carrying out the unsafe abortion. But what we normally do is to identify, of course, when you have the engagement, mainly the community engagements, and someone can come and ask you, then you have to refer and at least give the appropriate services. And we have had a number of cases, and at least people have received the services and came back to normal life.
So, Mr. Robert, what could be some of the challenges that lead to these women to use unsafe abortion methods to terminate?
The first challenge actually rotates on how the communities handle. I mean, there are things in their respective areas, because the peers themselves, especially the younger girls, the peers themselves do assure them that when they use maybe local herbs and everything related to that, they can, curb that vice and be safe in any way. But in actual sense, they face a lot of and a number of challenges in that one. Then another one is, of course, transport, because the nature of Kalangala is very unique compared to other areas. Kalangala is made up of different islands, where someone moves from an island to another one to receive the services. For example, we are an island district of over 84 islands, but the health facilities are very few. They would have been at least 84 out of 84, but you find many islands don't have health facilities. So transport costs becomes a challenge where someone have to board a boat and sail to another island, especially on this island. Actually, this is the biggest, where most of the services are. You find that people come from other small islands and to receive services here at the main island, and you find that they actually experience a number of challenges, especially rotating on high transport costs. Yes.
Yes, you have said, could you share with us what's the name of this island and around how many health facilities do we have?
Well, this is the biggest. I told you it's Bugala Island. It has Kalangala Health Center for. Actually, it's the biggest. It's the district referral. Yeah, it receives a number of refer cases from different areas, but it has also other health center theories. They are like there are six of them. The health facilities ranging from health center tools to this biggest where I report to the health center for. But other islands, anyway, other islands like Bukasa, it has a health center, and Mazinga has also a health center, but other small islands, and yet they are inhabited by people, by a big population of people, where they don't have, health facilities, and they have to come to this biggest island. For example, the government policy gives at least a parish that a parish is supposed to be with the health facility. But you find many parishes are comprised of different islands, and yet they don't have health facilities. So you find people, the mothers do come from other islands for this biggest to receive the services, and it really challenges them so much.
Are there any other challenges that you have heard of that propel these women to go in for unsafe abortion?
Well, since we are serving a big number of people, you find that we even have stockouts of the services, because we are meant to serve at least a certain population, a certain population of people. But since they do come, you find at times we do experience stockouts.
Stockouts in terms of medical supplies?
In terms of medical supplies, because we have that overwhelming number to serve.
So you as a community health worker, could you share with us what you are doing to help out these community women that come to you to seek information, all services? How are you helping them out?
Well, at first we integrate the the community outreaches, the community meetings, and there you give the information to people, because you convene a number of people, and you give out the information to them. So you find that they receive the information, and then someone can come individually in that all after the meeting you have convened, and someone comes and at least ask you more questions, and thereafter you have to refer that person for the services. But at times you receive complaints or questions of people who have really experienced their problems late.
I'm lost. Which kind of problems?
For instance, personally, I received a case from a teenager. Imagine she carried out unsafe abortion when she was in her primary level, but the peers tried to help her to carry out the abortion, which was really unsafe, and she really suffered a lot. She even reached on an extent of being referred to a big hospital there, and she confessed to me that she even lost her uterus.
Are you aware of what she used? Could you share with us what kind of unsafe abortion method she used?
Yes, I went ahead and asked her what she really used. It was local herbs. The peers told her you can use this enanda, you know, and she really suffered. She over she it was yes, breeding what, and eventually the uterus was lost. and she was open, by the way, to me. And this, you find that this girl was really psychologically tortured. She even left school because what she experienced, I mean, what she went through was really terrible to her.
So you, as a community health worker who is doing this tremendous work of sensitizing the community and referring them to access services, have you faced any challenges as a person while carrying out this work?
Uh, Mainly, I wouldn't have bring this as a challenge because it's my hobby. It actually became my hobby of interacting with younger people. Because however much you want to save lives, but the challenges with mainly transport costs, because Kalangala's case is very, very, very unique, but because it's very hard to be facilitated. I mean, to travel from, like earlier we talked about that traveling from let's say point A to point B to carry out the sensitization meetings, and yet they are so crucial. These people need our information. They really lack that information, and we need to tell them every day, almost every day, every time you get that chance of disseminating that information, you have to tell them. But you find it a bit challenging to move from different areas, and mainly to when you organize your schedules, you find it that at times you face those challenges of, it hinders your pocket. You find yourself injecting your real money, and yet you have to do other personal works. And yet, we are the people who are not on government payroll, but because we have that passion of disseminating the information, so that's how we are being maybe rewarded. Yeah.
So
Another challenge that I forgot, the misinformation. The misinformation is so rampant, because for you are sure that you are transferring that information, you are transferring the knowledge to people so that there is that behavior change. But the way people perceive you, the way the information that came before you, they tend to get that. Sorry, not being shy away, but the information the peers do experience to, with them, they really sabotage our rightful information that will labor much to inject to them. So it becomes a challenge. So we need to, we need to maybe to be much equipped with the knowledge of how to handle such situations. Yeah.
thank you so much, Robert. And you are still watching COHERINET TV. Let's go in for a short break. When we come back, we are going to dive more into the topic. Welcome back from the short break. You're still watching Building Bridges, and it is proudly sponsored by Anti-Khaki Helpline. We are still having our community health worker who is sharing with us insights related to his work on improving access to sexual reproductive health and rights services to the women and girls in Kalangala. So, Mr. Robert, you're still telling us some of the challenges that you have faced while doing your work as a community.
Another challenge is the community perception, where they could label a person who has carried out any abortion. So, especially men, they tend to diminish someone who is labeled in that way of being, I mean, or someone who has ever experienced any abortion in her life. So the community tend to look at, I mean, tend to isolate them, tend to look them at bad people, maybe. Then another challenge, because whenever we get any chance of disseminating the information, we tend to pass that information so that people can be saved their lives. Now this is a challenge. You cannot go to, let's say, church or a mosque to disseminate the information, and yet they know that abortion is being carried out in people. I mean among people, but telling the congregation, I mean, in a pastor, reverend, to allow you to tell people the fact that instead of going to unsafe abortion, at least you go to a health facility and receive the services, because there are benefits. Someone can put to risk of a risk of someone's life. So if we follow such procedures, someone can be saved instead of losing the unborn and the person herself. So disseminating such information to places like religious, places, is very, very hard, because they really against it. They see you as someone who is promoting the forbidden thing, because religion is teaching abortion as forbidden, as everything, as the highest forbidden. So explaining to them is a bit really hard, and yet it has a lot of benefits. It's not necessarily that people are going to carry out abortion every day, but it depends on someone's life, someone's situation, actually the environment itself, and you save that one. Then another one, the culture also. They regard that as a taboo in our communities. You find a lot of challenges and resistance when you disseminate such information.
Robert, what do you think leaders should do to improve access to post-abortion care services for women and girls in Kalangala District?
Actually, I would say that it's a collective responsibility of everyone. One, first to sensitize the leaders themselves, just to understand the goodness or the advantages of safe abortion. I want to emphasize it, that not every abortion that is going to be carried out, but the safe abortions, depending on someone's situation, at least they should be sensitized, and this can lead us to, let's say, waive some of the restrictions that are in place. Let's say legalizing abortion, depending on the situation. That should be a collective responsibility. That is people of different, the stakeholders to engage that, and right from the grassroots, so that it can be legalized as a law that is governing this country, depending on someone's life and health. Yeah, that is it.
All right, thank you. Do you have any last remarks to the viewers of COHERINET TV?
Well, one, I would love to thank COHERINET for this opportunity. In fact, traversing all the way from Kampala, many organizations do stop in Kampala, and they don't extend their services to communities, and yet the disadvantaged communities like Kalangala, they experience a lot of challenges. But since COHERINET has empowered us, because I feel I'm really empowered in one way or another to stand firm and sensitize the communities. really, personally, I'm seeing there is that impact, a very big impact, which can help the community to change. I know change is a gradual process, but at least if we keep on, reminding our people, if we keep on also being checked, because this is also an assessment being carried out, that if we are being assessed in one way or another, we are also motivated in somewhere, somehow, and we are really going to carry out these activities firmly. So I really thank you so much, and this project is really good. Only that I would recommend that we engage different stakeholders, because many people need this information. For instance, there are those who are against anything, not because they want to, but they don't have that information. They don't have that capacity to disseminate the information. So if we engage, if we make it comprehensive and engage different stakeholders, there are very many, the politicians, the leaders on different levels, the religious leaders, and we come up with a strong bond to make sure that our communities carry out, these safe, they carry out safe abortions, so that we have better life. So thank you.
Thank you, Robert, for sharing such amazing insights. It has been a wonderful discussion. Hope next time we shall be able to discuss more on what is happening in Kalangala District.
Wonderful.
So you have been a wonderful viewer of Building Bridges on COHERINET TV. Until next time, bye-bye.